Central Florida, you're listening to the most electrifying show in media. A Neighbor's Choice. I'm your host, your neighbor, David Gornoski. So glad to be with you live for another journey through the news and headlines together. And I wanted to have a guest on who can give us some more medical perspective on this pandemic so that we can continually learn what is truth and what is scientifically validated versus that which is pseudoscience or misinformation propagated by dubious media outlets. To do so, I have with us Dr. Phillip Triantos. How you doing?
Fine, David. Thank you for having me on.
It's great. Now, I'm glad to have you as well. You graduated from UAB Medical School. You practice in the Birmingham area as a radiologist. You've been having your own practice for 27 years. And you actually were hospitalized with COVID-19. Is that right?
That is correct.
Now, how did that happen? Tell me the story there.
Well, this is how I got involved with COVID. When it first was out, I was very interested in this new disease. It was sweeping worldwide, and, things just didn't make sense, shutting down everything, and, the story. But it really didn't hit me until I was actually diagnosed with a pretty serious heart-lung condition, and from that point, I kind of got out of the outpatient business and kind of worked from a home office to try to stay away from myself. But unfortunately, I ended up getting COVID and was hospitalized. And the condition that I have is one of the side effects that the virus itself can cause, pulmonary artery hypertension. So I knew that if I got to that cytokine storm level of the illness, where your body just overreacts, that I'd probably be in serious trouble. So my interest really started peaking then. I get out of the hospital, come home. My mother gets the virus. About 2 weeks later, she was living with us. And after improper treatment on her end, taking her to the hospital 3 times, no treatment, releasing her, no treatment. Anyway, she ended up dying from it, and I just sat there and watched her suffocate, not being able to do anything. And the physician that actually treated me actually gave me some ivermectin and some other drugs that were just coming out, and they were following the FLCCC protocol, Frontline Critical COVID Care Alliance, for Dr. Paul Merrick and Dr. Pierre Corey. He was following their protocol, and I really give him credit for saving my life. So from that point on, I dedicated my practice 50% at least to learning about the disease and the treatment of the disease, because what happened to my mother was unacceptable. Nobody should have an illness ever. We've never done this in our history. Have an illness and not be treated for it. And so that's when I really started to take a deep dive and dedicate myself to this. And people say, I get attacked several times from some social media people. It's kind of funny saying, what does a radiologist know? How does he know any of this? Well, I'll tell you what. I started the same day that all the infectious disease doctors started, all the internists started, all the so-called experts started, and I've listened to the world-renowned experts in the field to include immunologists, vaccinologists, physicians, the people that started the protocols. So I think I'm on a pretty level playing field. I'm an MD. I've treated patients. I've done multiple procedures. I've written multiple prescriptions throughout my career. I've treated multiple patients. So I feel like I'm very well capable to treat patients, and that's what I've been doing. And so here we are. But I actually started treating just because people were calling me friends, family, because they couldn't get treatment. So I started treating them by myself. And it got to the point there were so many of them, I was feeling uncomfortable because I didn't want to take the chance of any medical malpractice issue. So a friend of mine here in town owns several clinics, and we're in the same medical groups, and he said, just come join me and start treating here. So that's what I did. I now have a clinic that I'm associated with or affiliated with, and I treat patients for COVID early. And that's the key, early treatment. And our goal is to keep it out of the hospital where horrific things occur. And I've treated, which is a very small number considering my partners and the people that I'm affiliated with, where they're in the thousands. I'm in the hundreds, probably about 350 at this point. But I can honestly say that the people that I've treated have most recently been 80% plus have been fully vaccinated, 80% plus today. In the last 2 days, I've treated just 6 patients, all vaccinated. But there's only one person who was fully treated, had to be hospitalized, and that was an 86-year-old lady who's been smoking since the age of 14. So I'm not even sure if she was capable of following all the medications that I gave her and if she was compliant. One other person was hospitalized from a different illness that was unrelated to COVID, so I don't count that. But nobody's died. Everybody's done fine, and that keeps giving me the justification and the motivation to continue what I'm doing.
So you follow the FLCCC protocol, similar, that's what Dr. Pierre Corey and his team developed, right?
Correct. And I also, I'm a follower of McCullough, who I've met, and actually, this is something that's relatively new, and I've just been hired on, like, recently, the last day or two after an interview with Dr. Pierre Corey to actually join his staff to treat nationwide. But I kind of combine McCullough's depending on the patient, and everybody's variable. So I just look at the patient, I look at their illnesses, I look at, whatever comorbidities they may have, and then I decide which way to treat. Now, 99% of it is from the FLCCC protocol, and then I'll throw a little McCullough in there, and it's all, a lot of it overlaps anyway, so I feel very comfortable in doing that. And there's other great physicians that have been treating, Brian Tyson, Fareed, Zelenko, you name it, and all these guys treat very, similar, a little different, but they've all been super successful and hundreds of thousands of people. And so anyway, I feel very comfortable with doing that.
Now, were you able to get those medications you said while you were in the hospital when you had COVID?
No, sir. I forgot to say this. Lucky for me, when I did get COVID, I went to call my physician, and she wasn't seeing the COVID patients. She had one of her partners seeing COVID patients down at the end of the hall. So I went to that doctor, and he goes, look, this was early. This was 2 Thanksgivings ago, okay? And he goes, I've been studying these doctors out of Virginia and Wisconsin, Dr. Merrick and Dr. Corey, and this is their protocol. They say to use ivermectin. They say to use a Z-Pack. They say to use this, and this. I said, well, give it to me. I have no choice. So he put me on it. And back then, the amount of ivermectin, I don't know if he wasn't following the protocol properly or he just put me on a low dose of ivermectin for 1 day. But that 1 day I took it, my fever broke. Okay, I had fever for 12 straight days. And then I called him about 4 days later. I said, hey, Joe, that worked. Give me some more ivermectin. And gave me another day, my fever broke. And those were the only 2 days my fever broke. But I really do credit that doctor, Dr. Joe Shepard, for saving my life, because no telling what would have happened if I wouldn't have blocked or diminished that amount of viral load. So anyway, that's where I got onto the ivermectin.
But you weren't able to get those in time for your mother, you said, unfortunately.
No, well, I got in the hospital, and back then the hospital that treated me, the only treatment protocol they were offering, I really wanted to get monoclonals at the time, but I could not get them. I could not find them in the city, and the hospital that I was admitted to would not offer them to me once I walked in the door. And so they put me on a steroid and offered me Remdesivir, and just knowing the history of Remdesivir, I refused that because we know renal toxicity, hepatic toxicity, and about 3% of the people that get on Remdesivir die. So I wasn't.
What percentage? What percentage of Remdesivir patients?
3%.
Wow. All right, let's hold this thought. We're going to continue learning about Remdesivir and why it is that your government thinks you should take it, but they won't let you take something that's generic. We're speaking with Dr. Phillip Triantos, an MD in Birmingham, Alabama, and we will return after this short break.